And the Ministry of Health is tonight seeking the help of Parliament to plug the $59 billion funding shortfall that has been exacerbated by the USAID funding freeze. The ministry says it has requested $426.8 billion in the 2025-26 financial year budget estimates, but only got $172.6 billion in the just released budget policy statement. Emily Chabet reports on the crisis in the health sector that is likely to affect service delivery across medical centers in the country.
In what sounded like a chorus, the Ministry of Health and its semi-autonomous government agencies kept making requests before the National Assembly Committee on Health. The requests coming as the agencies lamented over limited allocation of resources in the 2025-2026 budget policy statement.
The State Department has 42 projects to be implemented in the financial year 2025-2026. The total allocation to the capital projects or programs is Kenya shillings 27.4 billion, comprising of Kenya shillings 13.3 billion under the GOK and Kenya shillings 14.1 billion under the donor-funded support.
The Health Committee taking to task the ministry and its agencies of unjustified budgets. Some were, however, quick to clear the air.
The account had received a total of 3.7 billion from the ministry, and we have disbursed 1.3 billion. From the returns we have received, we expect to disburse an additional 1.6 to 1.7 billion from that account to cover the facilities who offered primary health care within that quarter and had not.
At the national level,
28 billion gap at once is really huge for the country, especially for life-saving commodities. And therefore, as we prepare and conclude this budget, we need to look at those critical areas, especially supporting counties to roll in some of the programs in an integrated manner, and also not losing the current gains.
AMPATH, as our main provider of HIV care in the western part of Kenya, covering about 7 counties, specifically on just HIV, TB, malaria and other chronic diseases. So this actually will be one of the biggest areas which will be impacted by the USAID budget cut.
The Ministry of Health is asking for additional funding for what they call unfunded priorities in 2025-2026 financial year. They need 59 billion, of which 30 billion is meant for fully public financed primary health care system, 5 billion for procurement of strategic commodities like HIV, family planning and vaccines. Another 3 billion is needed to purchase essential commodities like blood bags, equipment to separate the different blood groups and cells, among others. The USAID freeze has created a 20 billion deficit. They also need an additional 1 billion to cover several presidential directives to fund health facilities across the country. The Kenya Medical Research Institute has decried a promise of 400 million that was later scrapped from the budget, saying it is time that the country financed its research programs.
Our center in Kisumu, our center in Busia, our center in Kericho and Kombewa are funded more to the US side. Kilifi is funded to the Wellcome Trust. We are requested for 100 million for transition for this 800 staff as a PE. This is still our prayer, that this is included so that we can be able to slowly start winning ourselves out from these dollar funds. And again,
Kemri was simply just having the center belonging to them. The rest of the research that was going on in that particular center, including the employees of Kemri, they were not even allowed to use some of the facilities therein. So what we are saying here is let's empower Kemri. Let's give Kemri that facilitation by providing additional funding.
A long-day meeting at the National Assembly that brought together CEOs from different health agencies highlighting the underfunding in the health sector. And now the leaders are calling on the government to consider 15% of the national budget goes to healthcare, insisting that a healthy nation starts with investing in the sector. Emily Chabet, Citizen TV, Nairobi.